Hello, I'm Dr. Paul Beckham from All Seasons Integrative Health in Fargo, North Dakota. Today, I was going to be talking about metabolic syndrome and our metabolic program that we have in the office, which can also help people who have had really a hard time losing weight. So it becomes really kind of the missing link for most people in helping them lose weight and keep it off, hopefully forever. Because what it's going to do, it's going to help you just learn how to eat properly. The diet that goes along with it is an anti-inflammatory diet, so we're helping to deflame or reduce the inflammation in your gut, which in most people, especially if they're having a hard time losing weight, it's being seen as more systemic inflammation throughout their whole body. And the patients that show up in our office, they have things like, knee arthritis, hip arthritis, arthritis in areas of their spine. And, they've been taking medications like non-steroidal anti-inflammatories. And the problem with those is they're really good maybe in the short term for decreasing, that acute inflammation, but then people end up with this long-term low-grade inflammation that is really setting them up for diabetes, heart disease, and possibly even stroke or all of them. And in our office, we do have a class that you can come into and just kind of learn how we can help you out. There's a questionnaire that you can fill out, and we can kind of let you know what the best program would be for you to kind of move forward to help, take care of your metabolic syndrome here. And after you sit down and, have kind of gotten some education, can understand and grasp a little bit better, hopefully with this podcast, you can get that as well. But knowing that, there is other solutions other than taking medications, which again, you're going to have to try and detoxify those things, through your liver and your kidneys, which are the problem areas in the first place. So it's more compounding the problem rather than helping. So literally a metabolic program, you're going to learn how to eat healthy, eat foods that aren't going to cause inflammation in your body. It might be a shock to your system if you've been drinking Coke and, eating Hostess Ho-Hos or donuts and pizza and all that kind of stuff all the time, because, it is going to have to be a choice, and one, where we'll be here with you the whole time to kind of, help hold your hand. We're going to help hold you accountable, because if you really want to get healthy, it's going to take some change. Again, depending on the program that you have, we'll sit down and go over that with you and let you know exactly what you need to be doing. But if there's something else that we need to help deal with, that might be something, after we get this metabolic situation squared away. You might be surprised that a lot of the things that you have going on are going to be coming back and be related to, the food items that you've been eating that have been causing inflammation in your body. And let's kind of slowly roll through all that as well here. So, if you're going to come in, and I'm just going to assume that you need to go through a metabolic program here. And I don't know, let me just go over how, most of the patients that are coming into the office, they're going to need almost the advanced support, where literally the first 3 months, you are going to be going through kind of basically detoxing out some of the water soluble stuff that's in your body. That's what the whole first phase is for, as well as to help just repair your gastrointestinal tract. So what ends up happening with people is they've taken things like I just mentioned before, non-steroidal anti-inflammatories. You maybe took antibiotics. There's other medications that can start to wear down on your GI tract. Alcohol, even, different hormones that a person might be taking can start to affect them in their GI tract, where you'll get intestinal permeability. And what ends up happening then is the tight junctions that should have on the cells in your gastrointestinal tract start to kind of come apart. They'll call it, in layman's term, like leaky gut syndrome, intestinal permeability on the scientific end of the spectrum here. But what you're doing then is you're just dumping stuff right back into your system. And especially with women, if they're a little more estrogen dominant, they're a little bit rounder, they're carrying a little bit more body fat. The problem with them, if this is what's going on, is that as your liver's trying to clear out this estrogen, you're basically dumping it right back into your system because your GI tract isn't and doesn't have that barrier to keep it out of your system. So you're just having like this leaky hose that's just seeping sewage back into your system. So that's got to get repaired. We need to get that all coated and healed back up, and you'll start to feel, tremendously better probably within the first, even a few days. It might be a bit rough. I mean, some people are going to go through a little bit of a healing phase, a little bit of withdrawal phase, especially if you've been drinking a lot of caffeine. You might have to ease into this here and slowly taper your caffeine levels off if you've been drinking coffee and all that for a few days before you start the program, so that you don't have a huge abrupt change here. But within that first 2 weeks, you're going to, it's not going to be healed, but you're going to start to feel better and better and better. And then the foods that you are eating, you're going to realize that, wow, I'm not even feeling hungry because guess what? My GI tract is getting healed up here. And you're going to be able to digest that food. You're going to not feel like you need to eat even the bigger portions like you probably were eating. And we need to cut down on some of the hormones, that are, coming from your GI tract as well. The leptin, the ghrelin, adiponectin, so that those aren't going kind of haywire here as well. So as everything's kind of calming down, and with the advanced support that we use, it's going to take 3 months to really get you through that here. But after that, your GI tract should be working really, really well. And at that point, we can literally use the phase 2 detoxification. And, if you didn't need that, the other program, it's just going to take a month to do it. But that's probably for people that have maybe done it before or just don't have a lot of problems going on. We need to just repair that gut a little bit. But I would say 80% of the people that I see come in the office, they're going to literally need to be doing that advanced support. So once we get into this fat-soluble stuff that needs to get detoxified from your liver and all that, now that you've got that whole GI tract kind of coated and healed back up, the inflammation's going down. Again, like I say, you're going to be starting to feel really fantastic. Once you start doing the fat-soluble stuff now, you're going to start, maybe feeling a little bit worse again, because now all of a sudden we're clearing all those pathways out that are clearing out like all the hormones again now. But now the good thing is you're going to be able to get them cleared out of your system. Whereas before, if they kept building up in your system and just say you're genetically set up for, estrogen issues where you could have an estrogen-mediated breast cancer possibility, now we're getting that stuff cleared out of your system. Whereas before, if you had that leaky gut or intestinal permeability, you're just setting yourself up for, getting cancer. And that's the word that nobody wants to hear here. But these are things you can do to prevent some of the stuff from happening. So if we can get this gut healed up, get you through that phase 1 and into that phase 2 where we're clearing out that fat-soluble chemicals like hormones, or even chemicals from a lot of people from workplaces. Farmers are exposed to a lot of chemicals. Factory workers are exposed to a lot of different chemicals. And you're just inhaling things, even through the air. I've had a patient, he's like, they're cutting things with certain devices, and a lot of that stuff is getting into the air. And you have to get that stuff detoxed out of your system. Like heavy metals would be another big thing. I mean, and people are drinking beverages out of aluminum cans, and even that can get into your system. Get rid of that aluminum cookware. That is not good for you. Get rid of the Teflon coated cookware. I mean, there's just environmental things that if you get little bits and pieces of that stuff into your system, it gets stuck in your GI tract. again, it's going to set you up. Your body's going to try and wall it all off here, but as it does that, you can get some abnormal cell growth, and that's where you're going to get some cancer starting from again here. So as we get that fat soluble stuff cleared out, that's going to take you about 15 days to do that. Then you're going to go through and kind of repopulate your intestinal tract now with the proper bacteria. There's going to be some fiber so that those bacteria can kind of take hold in there, and you really should be doing pretty awesome by that period in time. It'll take 135 days to get through that full advanced support system there. If you only need to do the basic one, that's still going to be 75 days. So but once you get done with that and you want to get into some weight loss, you've now set yourself up for success. You're going to be able to eat the portions. You're going to feel like you know exactly what you need to eat, because you're going to realize going through these programs that I didn't need to eat as much as what I had before, because even some of the intestinal issues, like we're just talked about getting probiotics back in you here, some people had overgrowth of candida. Candida just thrives on sugar, and most people are eating way too many carbohydrates. I mean, you want to eat more things like vegetables, and you want to eat all different colors of vegetables here, because you're going to get all your vitamins and minerals and all that sort of stuff through those different vegetables there. And you're also going to get a lot of fiber, so that's going to help clear your digestive tract out. I mean, there's just people that are constipated all the time. You're going to start to notice that you're actually going to be fairly regular as well. I mean, you should literally eat something and you should poop something right afterwards. I mean, that is the normal pattern. If that's not what's going on with you right now, you should probably be pooping at least once a day. If you're not doing that once a day, you need to probably start looking at something like this, or sitting down and talking with us. We might be able to do something else if you don't necessarily need the full gut health support here for metabolic syndrome or for losing weight. There might be some other things we can do, but again, everybody's different, so we'd have to sit down and discuss that with you individually. So again, as you get through the end of this gut health program there, that weight loss should just start to come off. And then, depending on how much you want to lose, then we can probably have a pretty good idea of, where you need to be at with that. And, again, we're going to be here helping to hold you accountable to that. We're going to also support you. There's educational processes that we have in the office where you literally on a daily basis are going to get information on what you should be doing or shouldn't be doing. You're going to let us know exactly that, yes, you took your supplements, you are eating the proper meals and all that. And yeah, if you want to add in other things down the road, like you want to start to exercise a little bit more because, hey, you're starting to feel better now. Those arthritic joints that were bothering you aren't really bothering you anymore, because not only you're getting some weight to kind of come off, but you just got all that systemic inflammation to go away. So there's just so many benefits to, clearing out that whole GI tract and getting your gut health in order so that you can have a healthy life here and be able to clear things out if you do happen to eat anything, that isn't what it, isn't the food that you should be. You should be eating foods that are closer to their raw state, salads, carrots, celery, get some turnips, just get a variety of different foods. If you haven't ever ate them before, try them, try them raw. A lot of them you can eat raw. Some of them you might have to steam or cook, but just try different things. You can always use just about any herb or spice out there to just give it the flavor you want. There's plenty of recipes you can find. Like, get out and you can use things like ChatGPT in some good healthy ways and find recipes that you could use some of these different vegetables in. So you might find something that's really palatable that you like to eat. I think most people, their taste buds will start to change because all the food out there right now is so processed and it's just loaded with sugars that people are just addicted to that sugar. It's a drug. I mean, it affects your brain just like all the street drugs that are out there. It's kicking in that dopamine level every time you get sugar. I mean, it's just crazy. So the more we can get you away from that for a while here, eating healthier foods, vegetables and fruits. Yes, some of the fruits have the sugars in them too, so you don't want to go too crazy with them. But, having a few servings of that a day right away is going to be, not so much so that it's going to keep something like candida or something like that continuing to grow on your intestinal tract, but getting you on that good, healthy track there so that, you can finally feel good and you can reach your full potential. Because if you're not taking care of yourself, just like on the airlines there, if you don't, if the airbags come out and the masks come down, if you don't put that mask on yourself first, you're not going to be able to help anybody else. In fact, you're going to start to become a liability for everybody else. So then they're going to have to try and take care of you. So take care of yourself first here. Get yourself in order. Then you'll realize all the other things you can possibly do now, because as you get healthier, you take weight off. I mean, if a person's, and this comes from the Mayo Clinic, if you're, every pound that your body is overweight, you put 4 pounds on your weight-bearing joints in your body. So if you're 30 pounds overweight, you're actually putting 120 pounds of extra weight on your joints. And if you have a knee condition, you might be surprised, hey, that knee condition, it gets better because I lost the weight, but it also gets better because we got rid of the inflammation. And this is all just being done through diet and nutrition, no medications whatsoever. Some people might need therapy in the office, and again, that's on an individual basis. We'd have to sit down and talk with you and see exactly what you have going on and what we might need to do in the meantime to just get you through that or get you treated. So I hope this helps, and hey, look forward to these podcasts in the future. If you have a question, please email in and let us know here. The other thing I'm going to do here is I'm going to attach a questionnaire that you can be filling out. It's the questionnaire that we give in the office here, so we can even let you know possibly if you do have something going on that would be like a metabolic syndrome type situation where we need to get your gut health in order. We'll let you know exactly what you would need to do with that, and we can sit down and discuss that further, after we have the question. If there's other things that are going on, there might be additional things that we might need to add, but again, everybody's an individual, so go look for that questionnaire. You can fill it out. We'll get it emailed right back to us in the office, and we'll get in touch with you and get you set up so we can either have a phone call or a telehealth visit, so we can help you out, get you finally feeling good, and live in your full potential. Have a good day.